This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, well, my name's Anthony. I'm the chief resident here at ECU. We have,
most likely, do you have a map?
we have a good residency program here for PM&R. We're affiliated with the Brody School of Medicine, ECU, East Carolina University. Our residency program director is Dr. Falk. Our APD is Dr. Morales, and I'm the chief resident. And we actually just hired a new program coordinator. Her name's Kiera. And she's been wonderful so far. She's only been here for like a month or two, so she's kind of new, but she's doing a good job so far. So our missions provide high quality rehab medicine and services for those people, helping individuals maximize their functional independence and return to their role in the community. Basically, we're trying to lead and teach in teaching and research in the field of PM&R. So this is our hospital and affiliated buildings. Basically, we have pretty big community hospital. It's like one of the largest hospitals, definitely in the state, let alone in the country. It's actually pretty large. So it's a blessing in disguise here for us. We have a 974 bed facility. It's a tertiary care center. We see a lot of different pathology. The hospital is the primary teaching site for like I said, the Brody School of Medicine, which is affiliated with ECU, and colleges of allied health sciences. We also have nursing school here at ECU. It used to be called Vidant Health. We actually just changed that this past year. It's now ECU Health. ECU is kind of merged with Vidant, and it's now ECU Health, bought them out. So we have a bunch of private practice physicians associated with what was Vidant is now ECU, and other health affiliates through 29 county region. We service a very large area in the state of North Carolina, basically like all of Eastern North Carolina. The system owns, manages, and leases hospitals, home health agencies. We have a surgery center, and then physician practices. We serve a large amount of people, 1.4 million people in the eastern side of the state of North Carolina. Jointly, the Brody School of Medicine offers basically ACGME accredited residency and fellowship programs in 32 specialties. So we have quite a few. We have a large teaching hospital. So this is the area that we service, basically a huge area, a bunch of different counties in Eastern North Carolina. We service basically all the way down to the South Carolina border and all the way up to Virginia border, and all the way west as basically as far as Raleigh. So anything in Raleigh will go to Raleigh, but everything east of Raleigh will come to us, Outer Banks and all that area. So basically, like I said, we service 1.4 million residents in this primarily rural geography. I'm not gonna lie, it's a pretty rural area. We do have like all of Eastern North Carolina is relatively rural, and even including the Outer Banks. So there's a lot of retirees out at the Outer Banks, and there's a lot of, obviously other folks. We're actually one of the biggest employers in the state, and especially in this side of this side of North Carolina, Eastern North Carolina. And we do have a lot of military bases around this area as well. So this picture is a couple years old, but this is our graduating class, I think 2 years ago. And this is some of our faculty and residents then. So some of these faculty have left. I got to update this to be honest. We just hired a few new faculty. We're a pretty small program in terms of our faculty. I think we have 7 or 8 functioning full-time faculty on staff right now. So on the top left there, that's our program director, Dr. Falk. He leads our wound care. So you do a lot of wound with Dr. Falk. He also covers some inpatient here and there, and will sometimes do outpatient. Then Dr. Milan, he is our spinal cord injury attending. He's board in spinal cord injury, and he is he did a fellowship, I think at ECU in spinal cord, and he also does wound care. He does pretty much mostly inpatient, does a little bit of wound care and outpatient SCI. Dr. Norbury, he's not with us anymore. He went to Texas Tech, but he used to do a lot of ultrasound with us. We just hired Dr. Rick. Bill Rick he graduated as a sports med fellowship trained attending from Pennsylvania, and he's joined our staff this past year. He's really good. He's leading the way with us with ultrasound. Like ultrasound guided injections. He also does a lot of EMGs. He's basically our EMG guy right now. And then Dr. Dinu is not with us anymore. Dr. Morales, to the left, bottom left there, is our APD. So she does a lot of wound. She does she's the director for the consult service, inpatient consults. So she will handle all of the consults that come in. She does EMG on Thursdays. So she does do an EMG clinic, and she does wound care as well. So she does quite a bit around ECU. Dr. Florida. So Dr. Florida has been with us a long time. She, I think, came on board 2018, 2019, so around there. She does lifestyle medicine and healthy weight clinic. And she does also an inpatient general rehab GR1 service. So she leads the way in that. Dr. Wilson has left, but in Dr. Wilson's place, we've hired actually a cancer rehab attending. Her name is Dr. Christina Paul. She did fellowship at Sloan Memorial Kettering and cancer rehab fellowship, and she does our cancer rehab. She also does like a hodgepodge clinic of all different PM&R stuff, wheelchair, spasticity, things like that. So and every once in a while she'll cover inpatient, but mostly outpatient attending. And then Dr. Parker, all the way on the right, he is our general rehab attending for inpatient. He does basically like medical rehab, things like that. He also is our stroke attending, so he covers the stroke service as well. Emily, I gotta update this. I apologize. Emily, we just got a new program coordinator. Kiara is now our program coordinator. She's not up here, but Debbie is also here. Debbie handles our med student clerkship stuff. So any of the applications that come in for away away rotations goes through Debbie. And some of these other folks work in the outpatient setting as well. Clinical initiatives. So we have electrodiagnostic services. We do a ton of EMGs. So one thing about ECU I think is pretty unique, and it's one of the best things about this residency program, is we blow the procedures way out of the water. We have well more procedures than what's required. EMGs, we usually get, somewhere around 220 plus EMGs. We have 20-week blocks, where some places I think have less than that, but we're lucky enough to have 20 weeks of EMG, which is great. We have sports medicine with Dr. Rick. So Dr. Rick is our fellowship trained sports medicine attending. He works with he trains fellows and us. He works also with the sports medicine fellowship as well. So we have one at ECU. And then interventional pain management. One of our, Dr. Milan, I forgot to mention, who's our spinal cord injury attending. He also does fluoroscopic interventional procedures like lumbar epidurals, things like that, and SI joint injections, hip injections under fluoro. And that's the block I'm on right now. We get 10 weeks actually pain block. And I know the minimum requirements like 5, something very small amount of interventional procedures. I personally have well over 60 interventional procedures now between SI joints, all that stuff I mentioned. I have, probably more than a lot of people, a lot of my colleagues, which is great. It's a great training environment. We do a lot of interventional pain here, and a lot of our graduates traditionally at ECU have done interventional pain as their career choice. Battlefield acupuncture.
So I can kind of piggyback off that. So hey, I'm one of the PGY4s. I think the name of the game, as Nova mentioned, is volume of patients. And I think the slide really hits home for that. We get a lot of patients, we're exposed to a lot of different things, a lot of different pathologies. Going off of a couple slides ago, patients in Eastern North Carolina are sick. And for better or for worse, we get those presentations, and it really prepares us well, both on the inpatient, outpatient side in terms of numbers and what we see. So two of our graduates, or soon to be graduates, Dr. Wortman, Joe Wortman, and Ben Buderbaugh, Dr. B as we call him, both got their top choice NAS programs out in Winston-Salem. They're following the footsteps of Jason Cullen, who's there right now. I myself am going through the ACGME match. I'm very happy with the return I've got so far. I've got 11 or 12 really strong programs as I put my rank list together for next month, and really happy with my yield. In addition to this, we do 10 weeks of pain, 10 weeks of ultrasound for people who are more injection heavier, if that's what you're interested in, which all these programs when I interviewed are very impressed by. On top of that, you get 5 weeks of elective, both 30 and fourth year. That really sets you up for success in case you want to pursue any fellowship opportunity. Pauline Scoron last year followed Dr. Rick's footsteps and used his guidance a lot to match into a sports medicine fellowship in Texas. So, we are very procedurally heavy. We are getting very diverse with it, cervicals, lumbars, even SIs. We get great exposure and great opportunities to do those things. So those numbers really do add up in addition to the EMG numbers that Sniffer mentioned.
Yeah, that's a great point. Thank you, Anand. We have a lot of our graduates going into pain and sports and things like that, which are very popular. So we're happy to say that. Let's see, we get some battlefield acupuncture at the VA. We get a lot of wound care. Dr. Falk that's actually something I think that's unique about our residency that I think something to take away is we do a lot of wound care actually. So if you're interested in wound care and hyperbaric medicine, so I actually plan on doing some HBO and wound care after I graduate, hopefully. So, it's a great opportunity. I got to take a week-long course in HBO, hyperbaric oxygen medicine, and which was pretty neat. So there's a few indications that we use for on a daily basis. So pretty neat opportunity. The program will pay for you to do that course, which is nice because it's pretty expensive. So it's nice that they pay for us to do that and they give us the education days to do that. Fluoroscopy, I already mentioned that. MSK ultrasound, to be honest, I didn't do it. I'm going to be honest, I didn't do a ton of ultrasound in residency until Dr. Rick came along. So PGY 4-year, you probably get more ultrasound than the other years, but I haven't had my sports block yet, but I've probably still done, 15 to 20 ultrasounds at this point. VA, you get a lot of MSK, EMGs of the VA, things like that. We do have a gross anatomy lab, so we do that usually once, twice a year, something like that. We go down to the anatomy lab and do that. Occupational medicine is an option. Orthotics and prosthetics, I'd say that's probably one of our stronger points. We do a lot of O&P. We have a great prosthetist we work with. His name's Shane. He's very good. And he teaches us a lot, and our attendings teach us a lot about O&P in their clinics.
He's an amputee himself, so he knows a lot about it and teaches it based off his own personal experience, which is valuable for us and gives us a lot of lectures in it too.
Absolutely.
I just want to say 4 minutes left.
Oh, geez. Okay. So this is our, these are our sites. We have some outpatient buildings, the VA, and this is on the top right is our inpatient rehab. PGY1, you do a mix of different things: internal medicine, cardiology, gen med, family med, ortho, neurosurgery, the list goes on. We do a lot of different things the first year. And then PGY2 is pretty much all inpatient except for 5 weeks. We are a very inpatient heavy program, and I'm going to be honest with that. We do a lot of inpatient. Second year is like 90% inpatient. First year is like this, 70, 80% inpatient. Third year is 66 to 70% inpatient. Fourth year is maybe like 10% inpatient. So we do quite a bit of inpatient, I'd say. And then PGY 3 and 4, you do EMG. EMG is only done during PGY 3 and 4, 10 weeks on PGY 3, 10 PGY 4. We actually do have an elective, which some programs don't have, which is nice. You get 10 weeks to kind of, you can do aways. Dr. Polari did an away, a couple of different places. And, he did his in pain, but you can do aways in whatever you want, as long as it qualifies. Let's see here. These are just some of the different topics we cover, like other PM&R programs, amputee, Botox, phenol, baclofen pumps, MSK ultrasound, different things like that. We get 28 PTO days, which is pretty cool. And you get like a week for Christmas too, on top of that, which is nice. We have paternity leave now, which is pretty cool. And maternity leave. So you get like a month off for childcare and stuff like that. Medical insurance, life insurance, workers' comp. And these salaries are not to date, but I think it starts in the 60s now. So that's nice. Resident benefits, let's see. Yeah, you guys can read through. You actually get food, a meal allowance for food, which is nice. $1,000 for moving expenses. Some other stipends, like I said, for the HBO course. We do get a board review course as well. Like I said, you can see these procedures. We just really blow it out of the water with the procedures. That's probably the best thing about our residency besides our residents. We have a lot of nice numbers there, as you can see. Yep, so you get a ton of different exposure. Lectures, we have journal club. You do 1 per year. We have grand rounds. You do 2 per graduate, two in total in your residency to graduate. We do the cadaver workshop, ultrasound workshops, pain grand rounds. We do a lot of pain here at ECU. Let's see, radiology rounds. Education, so we're one of the only schools that residency programs in schools that has a mandatory PM&R rotation your 4th year, which is good. So they get some exposure early on. Let's see here. Now our interns actually join us for PM&R didactics, which is cool. So you do PM&R even intern year. We have a nice facility here. Great gym. We have the Vidant Wellness Center, has a lot of different stuff there, which is good, and a pool. We do a lot of community service too here and there. We have this walk with the doc that we do. Let's see. We have a very like Dr. Polari said, we have a lot of pathology here at ECU. So we definitely see our fair share of sick patients, and we do not have, unfortunately, medicine co-management. So we manage all the medical issues. CAR for accreditation, our inpatient census currently is 60. We have capability for 75, I believe. Yep. Residency highlights, we have nearly 100% pass rate in the recent years. Right now we have full ACGME accreditation. Let's see. We're the longest tenure PM&R program in North Carolina. This is our resident room. One of the coolest things about our residency is our resident room. We have dual monitors during PGY2, well, your whole residency except for PGY1. PGY2 through 4, you'll be able to work here, which is great. We do our lectures Wednesday mornings, 9 to 11, and then grand rounds 8 to 9. Let's see. And we do have a lot of opportunities for learning. This is a couple snapshots of our inpatient rehab. So, patients get to do a lot of different activities. Post-residency, we kind of talked about that. A lot of pain fellowships, a lot of sports fellowships. I'm doing general rehab, so we definitely have that too.
Over, I think that's almost near our time. I wasn't wanting to know if anyone had any questions, if they wanted to ask anything from us as we kind of finish up here.
Let me look over the board, see if there's anything there.
What's the call like? So I'm actually on call right now, interestingly enough, and clearly I guess I have some time to come in and talk with you guys and things. Essentially, it's home call. Luck of the draw in terms of what the overnight might look like. Sometimes you have to go in, sometimes you have to go and actually have a dinner. That's why I hear the ambulance in the back with nothing to do with being near the hospital or anything. But if you have a sick patient, you go in, you send them up, you have a good night, it works out perfectly fine. It's kind of 50-50 draw. Honestly, I've had a good run of call recently, but that's generally how it works. And on the weekends, there's one senior, one junior. The junior kind of has a rough go of it because they're responsible for most things for most of the days. The senior kind of comes in, finishes their work, and they get to leave for the day. And it's kind of divided up amongst the 15 of us. Rotations for visiting med students. I don't think we accept international medical graduates for rotations. We did have one from SCU that did an membership, and we do kind of look into that from like the rank process, the interview process. You know, if you have you make an effort to come see us, we're always gonna factor that in pretty heavily. So if that's something you're interested, I would definitely email Debbie Mercer, who Snover highlighted earlier in the presentation. Avenues for research, absolutely. I did a lot of research. We have a PhD over at the School of Medicine that's really interested in publishing a lot of papers. So when I was going through the pain application cycle, I got a journal article, one first author and one second author, published in pain and then in pain medicine respectively. In addition, I just presented my grand round, my last academic requirement, with a case report I submitted and got accepted in AJPM&R. So those opportunities are definitely there for you as well.
Although I will say we don't really do random, at least that I know, I have not seen any randomized control trials. But we do have do a lot of case reports and things like that.
And to be fair, like an IRB is hard. You know, 4 years of residency goes by pretty fast. It takes a lot to get any prospective research off the ground. But I can definitely tell you that you'll have a lot of guidance in regards to retrospective research and people who are willing to write papers, publish papers, things like that. Research is kind of like however much interest you have in it. Our research requirement isn't heavy. It's essentially 2 posters at 2 different conferences, down from 4, which it was previously. But after that, you know, above and beyond, the world is your oyster. You can do as much as you want that you feel like is necessary for your career, your fellowship interests and things. And we do have resources. You do have to be proactive about it. I know I had to be, but in doing so, I got some very excellent results, I feel like. Call frequency. So the second year, the call weekdays are kind of graduated. So inevitably the second years will have a little bit more compared to me and Snover as the 4th years. Weekends, senior weekends are divided up among 3rd years and 4th years. So I think I only have about like Snover, like 5 or 6. Like we were kind of counting in the resident room, you know, kind of scheming a little bit to see how we could finagle and maybe finish a little bit earlier. So second year in that case, you know, it is a little bit rough. As Snover mentioned, you're on the inpatient side a little bit more, but as you go along, it gets a lot easier simply because you're used to it and you have more experience, and your situation management gets a lot better. Is there a particular part of your application that ECU places more emphasis on? I don't think so, Snover. I wouldn't say, right? I mean, I think it's a pretty holistic application. They don't look at anything too particularly, you know, it's not like we're, you know, killing for scores or looking for any specific thing that's supposed to make anyone else stand out from the rest. I think interest in PM&R is definitely helpful, but we match people from all over. It's not like you have to be from North Carolina either. I think even in our class of 5 of us guys, none of us are from North Carolina. So a distinct interest in the field and that being demonstrated is probably what's going to give you the best bet for getting interest here. I think that looks at most of the questions. I'll post my email in the chat so you guys can feel free to reach out to us. I think Snover will probably do the same. If you have any questions as you lead up to ERAS and applications and things like that, please do feel free to reach out. Let us know. We'd be perfectly happy to help. You know, anyone who wants to be considered by a program is someone we'll definitely look into, especially if you do reach out and show interest. That's something I know Dr. Paul has made a note of and wanted us to pass along to prospective applicants and things. So if you're interested in us, we'll definitely do right by you and do a strong review of your application as we go into the interview season.
Appreciate you guys having us.
Thanks so much for coming tonight, and thank you everyone who's watching. Please follow PM&R Scholars on all our socials and make sure you're on our email list. Have a good night, everyone.
All right, take care.